Thank you so much for this opportunity. I'm really excited to be here today and talk to you a little bit about how to communicate with the healthcare team. So let's see here. I have no disclosures. I am an assistant professor at the UT Southwestern Medical Center here in Dallas, Texas, and I lead the PKD clinic for the last several years. And then in addition, I run a research laboratory as well to study polycystic kidney disease. And I'm fortunate enough to have the PKD Foundation as part of my funding support. So let's get those things out of the way. So how do we communicate with our healthcare team? I think this leads to a lot of questions. And, even from my own personal experiences, I find that there are things that we can do better from both ends of our spectrum. And so just kind of the objectives of this discussion is really to understand which healthcare professionals really need to be part of your team when you've been diagnosed with polycystic kidney disease, and then how to assess specific healthcare needs and determine which healthcare team members should be consulted. So who do I talk to for what and when do I do that? And what's the best way to communicate such that, I feel that I'm being taken care of the way that I need to be taken care of. So there are many complications of polycystic kidney disease, and that often leads to an individual needing multiple different doctors. So for example, the kidney, when you have polycystic kidney disease, we talk about you having cysts in your kidneys. So this is an MRI image and where you can see that these are all the cysts that are in the two kidneys. But what you can also see is that these same structures are in this area over here, and that's actually the liver. So many individuals have liver cysts. So they need a liver doctor or even a transplant surgeon sometimes for this particular purpose. Another type of doctor for individuals with polycystic kidney disease is a pain management doctor. And this is simply because, as you can see, this is a normal kidney here, but this is the cystic kidney, and you can see how big that kidney can sometimes become, not for everybody, but for some people. And that can lead to a lot of strain on your back and your muscles and things like that. And so specific pain management therapies and approaches really are indicated for individuals with polycystic kidney disease, because there are medicines that we really don't want you to take, that are available over the counter that can actually damage your kidneys. And we don't want that to happen. And then another complication that often happens is that you develop a kidney stone. So, individuals without polycystic kidney disease develop kidney stones, but those that do have polycystic kidney disease also can develop kidney stones. And then, you oftentimes are referred to a urologist, which is a surgeon that takes care of kidney stones, and also a kidney stone expert that can actually help look at your urine and decide, are there certain risk factors that you're eating certain foods and things like that, that maybe predispose you to a kidney stone. And then are there ways for us to get around that and to modify your diet to reduce your risk? Some other subspecialists that oftentimes individuals may need are a cardiologist, just because with polycystic kidney disease, you often wind up with high blood pressure. And then in addition, you can have manifestations that happen within your heart, such as valve issues and things like that. The most common one that people know about or think about is the complication of having an aneurysm in your brain. So this is the MRI of an individual, and this is their brain vessels. And then this little balloon right there, that's the aneurysm, because the individual has polycystic kidney disease. So they need a neurosurgeon. And then some others that, are not so often talked about, but do exist and are actually quite common, are cysts in your pancreas, or even having just a hernia in itself. So you can see there's so many different doctors. So who should really be on your team? Do you need all of them? So in my opinion, I think if you have been diagnosed with this disease, you need a PKD specialist, and PKD specific nephrologist. You need a local kidney doctor or nephrologist. So, many individuals live really far away from a PKD center or from a PKD specialist. And so it's really in your best interest to have also a local kidney doctor that can help you with some of the things that are very common to all individuals with kidney disease, and then they can communicate with your PKD specialist too, as well. You need a good primary care doctor that you trust, and that you can go to. And then you need your family and your friends, because you can't do this by yourself. I mean, you can along with your team, but I think that the experience is much better if you have that relationship with your family and friends to also be on your healthcare team. Who else do you need? Well, it really just depends. So here are a few examples of individuals who have different needs. So Sally is 32 years old. She was diagnosed with polycystic kidney disease when she developed lower back pain, and she found out she had a kidney stone, actually. Kidney stone did not pass on its own. So unfortunately, she required surgery to take out the stone. And she doesn't really have any other complications of polycystic kidney disease. So who else does she need in addition to those 4 individuals that I just stated? A urologist and a kidney stone expert to reduce her risk of stone. But she doesn't at this point need a cardiologist or a neurosurgeon or anything like that. Let's look at our next case. So Ben is 42, and he has ADPKD since he was 20 years old. He recently developed some headaches that were new, and so an MRI was done, and it showed that he had a small brain aneurysm. So he needs a neurosurgeon in his team of doctors to help him deal with the aneurysm and decide what the next steps are. So those are 2 simpler cases. What about this? This is a little more nuanced. So case number 3. Elizabeth, she's 60 years old, and she noticed that her abdomen was increasing in size, but she was losing weight because every time she tried to eat, she felt like she was just full right away. She could never eat a full meal. So she saw her primary care doctor, and he did a CT scan, and he noted that she has polycystic kidney disease and polycystic liver disease as well. And it really seemed that the bulk of her abdomen was really due to her liver. So at that point, because she was losing so much weight because she couldn't eat properly, even though her liver was functioning properly based on her lab work, we really needed to refer her to that hepatologist and the transplant surgeon, because there's a special scenario that exists for individuals with polycystic liver disease, whether it's due to mutations that cause polycystic kidney disease or polycystic liver disease mutations themselves, that if your liver is so big that you're actually losing weight and you have sort of what we call failure to thrive, you may be a candidate for a liver transplant at that point, even though your liver is technically still working. And it's a PKD specialist that really can kind of remember to keep that part in mind, because this is not something that routinely that we think about all the time. And then this is sort of a last case, a very complicated situation. So Amelia is 42 years old. She has, unfortunately, very aggressive polycystic kidney disease. Her kidney function is already at about 18% of what it should be. She has high blood pressure, and she underwent an EKG, and that was abnormal when her primary care doctor recently did a routine exam. She's overweight and asking if there is a body mass index cutoff or a weight cutoff before she can get a kidney transplant. And finally, she reports that she took her dialysis education classes, and she wants to do peritoneal dialysis if she does not get a kidney transplant before her kidneys completely fail. So who else does she need? So she needs a cardiologist because her EKG was abnormal. She needs to be part of the kidney transplant program. So when your kidney function is less than 20%, we routinely refer you for evaluation for a kidney transplant as a way to start making sure that it's safe to give you a new kidney, or are there other things that we need to do to prepare you for a potential kidney transplant? She needs to speak with a weight management group or a weight loss specialist to talk about her weight loss, because we know that being overweight may be something that's detrimental for polycystic kidney disease, but also it may preclude her from being able to get a kidney transplant. And she's being very active in wanting to know the answers to those questions and prepare herself. And then finally, she is very aware of the concept that she may have to start dialysis before she gets a kidney transplant, and she's chosen to do peritoneal dialysis. So she needs to be in touch with a good surgeon who understands that peritoneal dialysis is definitely an option for individuals with polycystic kidney disease, and can be able to place that PD catheter or peritoneal dialysis catheter when it's time to be placed. So as you can see from these 4 cases, your extended team really is determined based on what you need. And these needs may change over time. As you get older, your needs may change. Some of the needs that you had, you may not need anymore. And so this is sort of a list of some of the most common referrals that I place in my clinic and groups that I work with on a routine basis closely to manage individuals with polycystic kidney disease. So how do you prepare for your appointment with your PKD doctor? So before your appointment, I would really advise you to write down, kind of all of your questions or things that you need to be addressed at your visit, especially when it's your first visit. You want to make sure that you can kind of feel that all of your concerns were addressed. And if it's possible, try to send these questions or concerns to your doctor beforehand. Now with the electronic medical record system, it's really easy to shoot your doctor a message. And, oftentimes the nurse gets it first, but if you can say, hey, I am scheduled to see you in 2 weeks, but, these are the questions that I definitely am going to have, especially if you have quite a few, and then that really helps, at least me, prepare for my visit with my patients, because then I can, I have an agenda of things that I want to address and take care of for each of my patients. But, if there are additional things, then I can plan our visit such that we make sure that everything is addressed and answered, in a fashion that, my patient is well taken care of, and so it's one of those things that write them all down, and, as more come, and then that way you also don't forget. One of the most important things to do is to always keep a list of all of the medicines and supplements that you take. You can even just take pictures of your pill bottles, bring them with you, and especially if you're taking some supplements that are over the counter or bought at specialty stores, bring them with you, or bring the ingredient list, because we're not familiar with all of them. New ones come out all the time. They change their names, things like that. And, we just want to make sure that what you're taking is safe for you to take. And then, especially when you're a new patient, bring your records from your other doctors with you. Oftentimes you move from one portion of the country to another portion of the country, and we are always more than happy, and we ask for these records to be sent to us. But as you know, and we know, it sometimes takes a little bit of time. So if you have CDs, if you have records, bring them with you. Especially, one of the things that not everyone may be aware of is because of this federal law called the CARES Act, that was passed in the last 2 years or so. Our patients should be able to see, in many scenarios, not all the time, what we have as doctors have written about a particular visit, and that should be accessible to you in some 1 to 2 week time frame after your visit, or even the same day as your visit. And these are records that you can keep, and you can bring them with you, and that will be a quick way for you to kind of be able to tell your new doctor or your other doctors what has been going on. I know the onus should not be completely on the patient and their families, but I think that when we work as a team, where we make our effort to get all of the records that we can, but if you can bring what you have as well, sometimes it speeds up how we can take care of you. So what do you do during your appointment? Make sure you ask all of your questions. Repeat the answers out loud, and if you can't repeat the answers, or if you don't understand, just ask again. We all come from different backgrounds. Different doctors use different terminologies, and so just because you went to a particular physician and they told you something and you understood it completely, and then you went to see someone new because you moved or something like that, and they say something and it sounds completely different, it may be that we just use different words for it. And so just ask, and we're always learning how to become better communicators to make sure that we understand each other. And so make that clear, because it's I will say it's very disappointing and frustrating to me, because when my patients are too scared to tell me that they just didn't understand, because I'm always more than happy to carve out extra time to make sure that we do understand. And I think all of your PKD doctors are like that. And we want to make sure that you understand, because that knowledge is the power that you'll be able to understand why we're suggesting certain things or telling you not to do certain things and things like that. And if you don't understand, then it makes it really difficult to follow what someone else is telling you to do. So that being said, again, don't be shy. We use a lot of medical words, and and there are no real silly or unnecessary questions. Everyone is at a different stage in their knowledge about their disease. Some individuals are brand new. It's a brand new diagnosis that, and that you're here today at this conference. And for others, you've known that you've had it, or your family members had it for many, many years, and you're very well versed. And so everyone comes with a different level of understanding. And so it's important that ask the questions, and ask the questions that, you may even think are silly. Like, is it supposed to really hurt here? Or someone said this, do I qualify for this? Or sometimes just say, this medicine, if it just doesn't make me feel good, because if you don't tell me, I don't know. And I really want to know, because that's the only way we can, come up with a plan that works for you. So on that note, and be honest, there really is no judgment. We want to have a relationship where we trust each other, and so everyone is human. We all understand things happen, especially in these last several years with COVID, and us having to do so many visits that are virtual, or individuals having hardships in their lifespan. They aren't able to always take care of their health, but just say that, I didn't take my medicine today, or I haven't taken it in 3 months because I can't afford it, because that will help us come up with solutions to finding ways that you can afford it. Can we change it to something cheaper? Did your insurance change and we need to change something, because our goal is really for you to have the best outcome, and there really is no judgment. But we can't just, it doesn't work well when you just say that, hey, I am doing everything. If you're not, we'll just keep adding medicines. And then one day, if someone, I've seen this happen where an individual winds up in the emergency room and they have a list of medicines that they are taking all of them. And so then the doctor in the emergency room says, yeah, if they're taking all of them, I'll just start them all. And then their blood pressure becomes really, really low, and they get really dizzy and lightheaded. And unfortunately, they were not taking all of them, and so we want to have an area, a safe space where you can just be honest with each other. There really is no judgment. We understand. We want to get you to a place that everything works for you. So then, from an exciting standpoint, ask what's new. Polycystic kidney disease, I feel like we're in a time where there's so many exciting things going on. And I think you've had this opportunity to see some of this at the Connect conference this weekend. In the last decade, we have a drug that's FDA approved to slow down the disease. And so ask, do you qualify? Why do I not qualify? That will provide you some, additional understanding of the disease. Are there clinical trials that I can sign up for? If you as the center are not offering them, is there another center that is? And is that something that I should look into? I read on my Facebook group this, or with a Twitter feed that, or actual research journal this. What do you think of that? I think that it is very good to be empowered about what your disease is, if you're at that stage, to learn more about it and want to participate, because I think that will really drive you to want to embrace what different interventions come out and things like that. And as a physician, I always find it very satisfying to know that, my patients are really quite on top of what's going on. And sometimes, if I didn't read the newspaper this morning, or if I didn't, check my journal article at 7 or 8 o'clock in the morning, and I go to clinic at noon and they bring it to me, they said, this came out today. It's from a very biased perspective, it's very quite satisfying to me as well, to see that the community is so involved and wants to know. So don't hesitate to ask what is new. Ask every single time. So some other things to do during your appointment is, to take notes and listen, to what the discussion is about. There's sometimes, and especially when it's your first visit, or as your disease, and if your disease unfortunately progress and things become a little bit more complex, there's so many different moving pieces that it's really easy to forget. And we all do this. So try to bring something to take some notes. We always try to provide you with a piece of paper at the end of kind of an action plan, but write your own notes as well, and then listen. And if you can, consider bringing a family member with you, especially if you're nervous. It doesn't hurt to have another pair of ears to listen and to help understand what is said. We all understand things differently as well. And sometimes they think of questions that you or I didn't think of either, or some logistical things that, may make the interventions that we're considering as a team not feasible, or ways to make them more feasible if we think that they are not feasible. And so it's always helpful to do that. So what do we do after, or when you kind of are walking out from that clinic? Make sure you have kind of that action plan from your doctor, whether they say we didn't change anything, everything looks great, or we ordered these tests, or we're changing these medicines. Make your next appointment, even if it's, a year out. So that way, at least it's in the books. If you need to change the date, no big deal, but at least you haven't been lost in the system, and mark on your calendar or on your phone, if you're supposed to communicate back with your doctor. Oftentimes we say, okay, let's change this medicine, check your blood pressure for a week, come back and let me know what it is. Or we say, okay, we ordered that MRI for you. Let me know when it's done. And that way we can make sure we have a follow-up appointment for you. Ask how each doctor communicates with the rest of the team. So it's really important when you have polycystic kidney disease that your primary care doctor and your PKD specialist communicate with each other. And we routinely send our notes to each other so we know how things are going. But ask that each doctor sends, all of these other subspecialists that you may or may not see, send that communication to both your primary care doctor and your PKD specialist. I think you can see that, oftentimes, the PKD nephrologist winds up doing some portion of that primary care just because there are some complexities and unique needs of individuals with polycystic kidney disease that we really can help the primary care doctor out with, making sure that you get the right referrals. But it's important that all of that information is sent to both sets of doctors so they know exactly and can keep tabs of, kind of coordinating all of your care and seeing what order things are done in. How do you reach your doctors? We live in a world where, back in the day, you had to call on the phone and leave a message and they said, okay, well, the doctor will call you back or something like that. And that actually still exists. You can still call the doctor and, but there's also this electronic medical record system. So it's important that you ask, each member of your team, how do they prefer to be reached? Do they prefer to get a phone call or do they prefer to just kind of use the MyChart system? If they use that electronic system, how often, how quickly should we expect a response and who is checking it? Because in every scenario is a little bit different. Some systems are set up such that, you may receive a response the same day, and depending on the scenario, other times it may be several days. And so just knowing where to set your expectations of which method to use. And then what if you have a hard time reaching them, and then you eventually do, just let them know that, I tried this, but I didn't hear back, for this long. And sometimes, we are all human, things fall through the cracks, or we're just trying to make our system better. And so let us know and see if there's a simple solution, that perhaps there was something on our end that we could have done a little bit differently. So that way we could, make sure that you were able to reach us, or, there was a break in the system. And then we can tell you that, we apologize. This is exactly kind of what happened. And so, we will work on that not happening again. So who do you call for what? So the way that I think about it, and I think that will work best, is if you think it's related to your kidneys, call your PKD specialist. Oftentimes it's like blood in your urine, really bad back pain, your blood pressure is not controlled, you're having some swelling in your legs, trouble breathing, things like that. Then they can guide you as to what are the next step to do. Okay. If the question is regarding specific complication of polycystic kidney disease, call that subspecialist. So if you are having, unfortunately need a pain management doctor and you're on pain medicines and the pain medicine isn't working, go ahead and call them. They can help troubleshoot that. Or if you think it's a side effect due to a medicine that they prescribed because they warned you about it, you'd say so. Or and similarly to your liver doctor, to your neurosurgeon or your cardiologist. What about some general things? I have a cough, cold, what medicine to take, something that I don't really think is, you don't really think is related to PKD. Start with your primary care doctor. It's really important that you have a good primary care doctor, someone that you can reach, because they have the best system set up for off hours, answering questions and, directing you to the right place to go and things like that. And then anything that's related to a particularly prescribed medicine, speak to the provider or the clinic that prescribed the medicine. And the refills really should only come from the doctor that prescribed that medication only. And this is in your best interest because then it keeps everything very straight, and so that way, the doctor that's prescribing it knows that they're the ones that are refilling it and that nobody else hopefully is doing that. And so they know that you've been on it for this long and that you continue to be on it and that they're the ones that are changing the dose if you need to and things like that. And that will just keep all of your, everything in a particular order and would lead to less confusion. And then finally, if it seems serious, everyone has a great sense of, when they know themselves best. And if they really think something is wrong, don't hesitate, just go to the nearest urgent care emergency room for evaluation. So what are some of the action steps after, this presentation here today? I would suggest the most important things that we do is start keeping a list of, questions, concerns for your upcoming appointment. Just keep a little book. And then, as things come up, if they're not urgent, you can just kind of keep them together and say, oh yeah, I heard this. Let me just write this down. Organize all of your medications and supplements, and then keep a record of all your physicians, their contact information, who you see, and things like that. And just that way, I think it will be best served to keep it all organized. And then finally, I will take any questions. I really appreciate your time today. And I've listed my contact information here in case anyone wants to reach out.
Excellent. Thank you so much for that presentation. We have a lot of really interesting questions. So the first was about getting all the different specialists to communicate. You talked about making sure everyone has all the same information. One example we had was maybe two doctors just to disagree on the kind of medication you should be taking. How do you advise someone handle that?
So, the doctors should talk to each other. You should definitely ask why they disagree. So that way you understand, you're all very smart individuals. And so, that way you kind of get a sense of why. But, this does happen. And this happened to me this week as well. And, I always say that, just let me know who it is. And then I'll ask my nurse, reach out to them, and, we will be happy to discuss, what is the best course of action. And then we should both be getting back to you with the exact same resolution, would be the most ideal scenario. I know that doesn't always happen, but that should be the goal.
And do you have any guidance on someone who has heard that perhaps you should get a nephrectomy or have a polycystic liver removed, and getting differing recommendations from different doctors? Do you have any advice for us on that?
I think it's always good to ask for another opinion and do what's right by you. If you're getting conflicting opinions, ask for a third one, and see if it makes sense to understand, and sometimes, I will be honest, there's not always a clear-cut answer, and so, both answers may be correct. And then we have to, decide what's the best for you as an individual, and yeah, it's a difficult situation. I completely understand. Yeah.
What about any tips for when you first get a referral to a new specialist? How best can you set up that relationship and get the care you need?
Okay, good question. So, I think it's great when you have, so say for instance, you have a new referral, you call and you make that appointment, just go ahead and ask them, can I send you some records of what I do have? What do you need? Can I go ahead and sign the paperwork so you can request my records? Because I will say, in my personal experience, it works out I think that the patients also enjoy it much more when everything that can be sent has already been sent to me, and I've been given the opportunity to review it. And so then the first visit is extremely productive. I think oftentimes, given our system, we don't always get all of that information. And oftentimes the first visit with a specialist, especially if it's, we'll say, oh, you've already had this study, but I haven't seen it yet, rather than making you do it again. Let's get those records, and then we'll decide what to do next. And then you leave thinking, well, what was the point of this visit if you didn't have the information that I needed anyway? So if you can help us get the information, I would really appreciate it. I know the onus should not be completely on you, but I think it's very important to be an advocate for your own healthcare. And so if you can, facilitate that would be really helpful.
And what about a clinical trial doctor or study team and your regular doctor? What kind of interaction should they be having?
So usually there's almost, very little interaction, in the sense that if you are, for instance, let's say, you're in a clinical trial that's at a different center, they are under no obligation to let me know that they're in the trial. It's usually you as a patient that tells me that, hey, I'm in this clinical trial. Where they are under obligation to make sure that you're taken care of as part of a clinical trial is if something comes up during the trial, that needs to be addressed, then either they themselves or they can send the patient back to, a different doctor and let them know that, hey, this came up during the trial. But, because of specific privacy rules and trial rules, we don't specifically communicate with each other, and it's not something that's routine. Yeah.
Okay. Here's a question. Should someone ask their nephrologist how many PKD patients they see? Is that an important thing to ask?
I think that, I don't think any nephrologist would be offended by that. If you asked me 5 years ago, I would say, well, you were my first 1, 2, 3, and now that answer changes over time, and so, yes, you can ask them. And I think that so many of our great nephrologists in the community say, I see so many, but I really prefer that you also see a PKD specialist too. And then we can work together, because they have the most recent tools, and we can help you.
And there's a question here about PKD specialists, say in a certain area, say Texas. Are you all talking to each other? What do those relationships look like between different PKD specialists?
So that's a great question. So I have, as a younger PKD specialist compared to many in the rest of the country, and growing our clinic here at UT Southwestern, I have no hesitation asking for help or answering questions and things like that. If I'm something that's not routine, perfect PKD and looks a little odd to me, I have no hesitation reaching out to, mentors or leaders in the field, asking them, hey, I have this case. I'm not quite sure. What do you think? How do you do this? And so we do have a relationship where we communicate with each other. We also, when patients move, they need to find a new PKD specialist, we have no hesitation sending them on to the next specialist, and so we do all talk to each other. And then also, because of the foundation, the foundation does a great job of trying to integrate us and knowing that we all do exist. And so sometimes we just don't know, who is where, and especially newer and younger places. And so we do all talk to each other. Yeah.
And, you mentioned, being honest with your clinician and helping facilitate the conversations between maybe differing opinions. But there is, of course, a fear of maybe angering your clinician or your care team and that being held against you as a difficult patient, or, how do you advise someone to think about that, about, advocating for themselves, even if it does bother someone on the care team?
Yeah, I think, we all have our own opinions, and we all want to do what's best by us. And sometimes, it's not, there's a conflict. I understand, between the physician or the team and the patient. They do or don't want to do something, right? Like the patient themselves do or don't want to do what the team wants, or the team does or doesn't want the patient to do a particular thing. And so in my experience, I find that it's best to be cordial, kind, and respectful, and if you are cordial, kind, and respectful, and can communicate that I do or don't want to do what you're asking me to do for these reasons, and I'm not going to do it, but if you can say it and then in this way, as opposed to in an angry way, I personally would not be upset. I would say, okay, I understand our goal at the end of the day, you are your own person, and you have to do what's best by you. I can only advise you of what I know based on my knowledge. And if that means that we, are completely differing and you want to see someone else, I would be more than happy to send you to someone else, because I want what's best for you, and not everybody gets along with everybody, and that's okay, And so, but I think trying to approach it without confrontation is probably the way to achieve the best outcome, because then we can both respectfully understand that we have differences, and then try to find a way to move on.
And how would you advise someone who, we know that there are people who are diagnosed with PKD in childhood, so maybe they'll see a pediatric nephrologist. What should it look like once that child ages into adulthood, needs an adult nephrologist? Should that be a seamless transition? How should that look like? And what kind of questions should you be asking?
Yeah, exactly. So I think it's good to start preparing, when your child is around 16, start talking to their nephrologist, say, hey, in 2 years, who am I going to see next? um, and then that way you have some idea of what your nephrologist plan is. And if you do or don't want that plan, you have time to change, who that is, moving forward. And then you have sort of a seamless transition to move on to the next nephrologist. And so that way that your pediatric nephrologist can send your records to your adult nephrologist, and often centers have kind of a collaborative relationship where the, pediatric nephrologist and the adult nephrologist are good friends, and they say, hey, I'm sending you one of my patients next week, and we do talk like this, and this happens very often. But we want that seamless transition. That is very critical and important, because that age of 18, you're about to go to college or start a job and things like that, and you have to learn to kind of take some responsibility of your own health problems, but you still definitely need some support from your family who's been taking care of you with this disease for this long. And so it's really important to have a good transition at that time. And hopefully you don't need to see the doctor more than once a year, when you come home for summer break or whatever it is. But I think it's really critical, because that will give your child that opportunity to grasp and have develop a quick, happy relationship with their nephrologist that they will be able to sustain on their own and know what that expectation is before they're kind of let off to do it on their own.
And what would you say to someone who has an adult child who is not yet diagnosed? There are concerns around accessing life insurance, for example. How would you advise someone if they're thinking about assessing a family member for the disease?
Sure. So it's a really personal decision, and there's not a right or wrong answer. And the reason for this is because there is not a cure for polycystic kidney disease yet. If there was a cure, we would say, well, let's find out so we can give you the treatment for it. But because there is not, there's a lot of fear around being diagnosed because of things like life insurance, whether you will still be covered under your medical insurance plan. I mean, we have that protection right now, but we may not forever, and things like that. And so what I generally advise, parents is, you have to decide with your child, what is best for you. And so if you choose to find out, we can go and find out, with the expectation that if you go and try and find out, that answer that they don't have it may not be definitive, because sometimes if you have very mild disease, we may not know for sure that you don't have it. So that's one thing to keep in mind, that you may not be just kind of given a clear frame of answer right away. And the second thing is that if you choose not to find out, your child should continue regular healthcare, which means once a year well child checkups with their pediatrician. And if something comes up to suggest that they're having a complication, such as a kidney stone, or if they find out they have high blood pressure, at that point, it may be reasonable to start looking into whether they have this disease, because we want to slow down the progression of it. And if you're starting to have complications, then it is important to find out so we can start treating it to get the best outcome possible.
Well, and with that in mind, say you are someone who is, your kidney function starting to decline, you're just seeing your usual nephrologist. At what point, or should you ask to see a PKD specialist?
So I think now everyone with PKD should see a PKD specialist at least once, just to know if they, well, it's personal preference, but if they want to know how aggressive is their disease, since only half of the individuals that develop AD-PKD develop kidney failure and the other half don't. Many individuals want to know which half do they fall in. And if they do fall in that aggressive half, when is this going to happen? And we have the tools to do that. And so I think that, at least once you should see a PKD specialist, and then decide how frequently you really need to be seen by a PKD specialist. It may be once a year, maybe once every 2 years, hopefully, or it may be more frequently, depending on what your specific needs are.
Could you also clarify for us how you diagnose someone with AD-PKD?
Sure. So the diagnosis officially is based on knowing what your family history is and what your imaging findings are. If you have a family history of polycystic kidney disease, we look at what your ultrasound or your MRI shows, and we have a criteria based on how many cysts that we see, whether or not you have the disease, and we can rule it in or rule it out. If there's really no family history, the diagnosis becomes a little bit tricky, because if and to officially call it the disease, we often have to do genetic testing to find the mutation that's causing it.
And let's see, there is a lot of research coming out right now about the benefits of certain diets in slowing disease progression. If you're interested in what that would look like for you, maybe it can be challenging to find a dietitian. What do you advise for starting that conversation with your doctors?
So I would advise go ahead and say, hey, do you have a dietitian that you have access to? Most places will have access to one, or they can refer you to a dietitian. You should also take that extra step and see what kind of coverage your insurance provides for a dietitian as well, because there may be a set number of visits that your insurance will cover, and that will help frame what your discussion is going to be about with that dietitian as well, to determine what the cost will be. Many insurance companies do pay for a dietitian counseling, and some unfortunately don't, or you may have to pay out of pocket. But to just, don't hesitate to say, hey, I need a dietitian to help me out.
Are there any other specialists that you think are key to an average patient aside from a nephrologist?
I think if you have a nephrologist and a primary care doctor, those are the keys, because then both of them will know who else to send you to. And our goal is not for you to have 15 doctors if you don't need them. We just want you to have the doctors that you really need.
Excellent. I think we've addressed all of the questions. Is there anything else that we would like to ask Dr. Lapkia before we sign off? All right, you're also welcome to message me on the platform, Elise Hoover, or email research@pkdcure.org, and we can make sure and get any other answers for you as well. And then we have a 20-minute break, and then we have our final session of the conference, the plenary. It's an update about what the foundation's been up to. My boss, Chris Rusconi, will be presenting on a new program we're launching this fall, so I hope you all join us. And thank you again so much for joining us for this session. Thank you, Dr. Lakia.
I had another question.
Oh, sorry, Michelle, of course.
Yeah.
Sorry. I was asking, when I was diagnosed with PKD, it was done via ultrasound. Is there a genetic test now or blood work that can be done to diagnose it? Or is it still an ultrasound?
So it depends on the situation. We do quite a bit more genetic testing for the diagnosis, but we need to see what your kidneys look like as well. The testing for ADPKD is a little bit complex because the genes that cause polycystic kidney disease, the one that causes most of it, PKD1 gene, is one of the biggest genes in all of our DNA. And on top of that, it has a few extra copies that look like that, but aren't actually the PKD gene. So the testing that we do is not 100% perfect. And so it's possible if we do a genetic test on you, it can come back negative. But when we look at the pictures of your kidneys, we see that you have many cysts. And so it's really a combination of family history, what your kidneys look like, and then potentially looking for a mutation by doing genetic testing as well.
Okay. All right.
Great question.
So after all that's done, does that give you a more definitive answer, or still not completely so?
Good question. So if you say, for instance, you said, oh, my mom or my dad had PKD, and then you come in to see me and we do an ultrasound for you, and you have cysts on your kidneys, that meet a particular criteria based on your age, that is sufficient for me to diagnose you with the disease. I don't have to do the genetic testing, but if you come in and you say, no one in my family has ever had this disease, nothing like anywhere close to it, and then your ultrasound shows that you have cysts in both of your kidneys, I would say, okay, it looks like you have polycystic kidney disease. We can do genetic testing to look and see if, what mutation we find, but there are some limits of the test that we may not get a definitive answer. And so if we do the test and then we find a mutation that has been specifically, I would say, kind of certified as a mutation that causes the disease, then we can be sort of 100% confident that this is exactly what you have. The reason this is becoming a little bit more important now is because there is Genericue, like as the one drug on the market to slow down the disease. And in order to qualify for it, you have to officially have polycystic kidney disease as a diagnosis. in the past, we didn't have a specific therapy. And so at the end of the day, I could say you have polycystic kidney disease, but do you have AD, PKD specifically, or is it something a little more nuanced? It didn't change what I did for you, and now because that there is a drug on the market, more coming, more clinical trials, things like that moving forward, we're becoming a little bit more picky of saying that you have that definitive diagnosis. And by me, I mean insurance companies are becoming much more picky about knowing that you have a family history, or you have a mutation testing confirmation.
Interesting. And lastly, is there a certain age that you would start the testing at? As an example, my kids are 15 and 12.
So it's a personal decision. And, some families want to know right away or as early as possible, and others don't want to know, out of just, fear or fear of, life insurance and other stigmatism and things like that, or just even mental health purposes. And so I advise all of my patients that make sure that their kids get routine healthcare checkups. And if something shows up, then maybe consider, pursuing to find out, whether or not they have the disease or not. And then otherwise, it's a personal decision that I would not kind of step in the middle of.
That makes sense. I just didn't know if the tests were geared towards a specific age or starting at a certain age, or if it can be done at any age, basically.
Yeah. So if you want to know that you don't have the disease, if you have, say, for instance, you have a sister or something like that, and she wants to give you a kidney, and she says, I've never been checked. I don't know. And she's only 35 years old. If we do an ultrasound on her and she doesn't have any kidney cysts, I cannot at that point be 100% sure that she doesn't have the disease, because we really want you to wait till you're about 40. We can be 100% sure if we try to do genetic testing to see if she has the same mutation you have, And so there are kind of layers to this to see.
Interesting.
Yes.
That's because when I first was diagnosed, they said that everything can show up until age 30. And if you didn't have by 30, you were in the clear, basically. Yeah. So now you're saying it's 40.
Yeah, we really like to wait until you're, 40. I mean, if you were 30 and you had nothing and it was really completely clear, I'd be pretty confident, but I would be still a little hesitant to let, someone give that, give that kidney away, just without understanding that there are risks that they may still have some mild disease or something like that.